Today, we're going to talk about oxygen saturation and respiratory rate. Why one might be normal, why the other isn't. Let's create this scenario together. You're breathing very, very fast, maybe by running or by anything. But your oxygen machine is saying your oxygen level is very normal, which is your SpO2. And the next scenario whereby you're breathing normal, you're not struggling to breathe, but your oxygen saturation is very, very low. How is that possible, right? This, you need to know. Let me explain. Firstly, to understand this, you need to know that oxygen saturation and respiratory rate measures two different things. Secondly, oxygen saturation, also known as SpO2, measures how much oxygen is attached to your red blood cell. It ranges in adults over 95 to 100. Respiratory rate measures how many breaths we take in 1 minute. When I talk about breath, I mean in and out. That's 1 second. So it measures how many breaths we take in 1 minute. And this ranges in adults can differ. It can be between 16 to 20. Some textbooks used to write 18 to 20, and other textbooks write 12 to 20. So it differs. So if your lungs can't transfer oxygen properly due to conditions like heart disease, lung disease, or even infection, your oxygen level can drop even if you're breathing calmly. I want you to know that oxygen saturation and respiratory rate are relatable, but they are not the same thing. You can have very fast breathing when your oxygen is normal due to something like exercise, pain, stress, or even anxiety. And also, you can have normal breathing, like calm breathing, where your oxygen level is low due to conditions like lung disease, heart disease, and infection, which hinders normal level of oxygen to transfer in your blood or attach in your red blood cell. So one number explains how well oxygen is getting into your body, and the other explains how hard your body is trying to breathe. This is the reason why nurses and doctors never look at one vital signs. They look at both to know where the problem is. If it's the heart, the lungs, or even anxiety. One might look normal and the other isn't. That alone can change the course of treatment. I know by
One
now
might
you'll
look
be
normal
asking
and
yourself, how am I going to know I have this underlying condition even when I'm breathing calmly? That's one reason you shouldn't play with your vital signs. You should check it at all time, because when you check it at all time, it's easily detectable, because things like oxygen dropping happens silently, and there are earlier signs of all these conditions I mentioned before, like lung disease, heart disease, and infections of any kind. That's why you see nurse and doctors don't joke with your vital signs. It helps them know how to manage you properly, or what your diagnosis will be, or what the next line of treatment will be. Understanding your vital signs help you worry less and act faster. Follow ordinary
follow
summary for simple tips and health education. Love you.